invitation. It is such a pleasure to be here with you today. I'm just going to share my screen here, and then we'll get started. Okay, how does this look? Can you see my slides okay? Okay. Well, so today I have the pleasure of sharing with you a little bit about my career in pediatric cancer nursing, and then also to share about different career opportunities in pediatric oncology. First, I would like to share with you my why. I think it's very important that when we think about our career, that we have an internal compass and motivation for why we do what we do, that will keep us going for many, many years. I was inspired to become a nurse through several international service trips after high school. And it was at this time that my eyes were open to great need internationally, and I saw nursing as a practical way to be able to help hurting people. So I was drawn originally to working with children and terminally ill children. I returned home and I searched the internet for different pediatric chronic disease specialties because that's what I was drawn to. I also looked up different hospitals within the United States as well as international programs, envisioning myself ending up doing international work as a nurse in the future. And I looked at different nursing programs. Fast forward several years, and I graduated with my Bachelor's of Science in Nursing from Michigan State University. And I accepted my first nursing job at St. Jude Children's Research Hospital, which is a pediatric cancer hospital with an international outreach program and research focus. These were the three things that I had been looking for in an organization. I obtained my certification as a pediatric hematology oncology nurse. And then I pursued my master's degree as a pediatric nurse practitioner to gain additional knowledge to apply to future international work. And as I sought nurse practitioner positions, a nursing coordinator position opened up in the international outreach program at St. Jude Children's Research Hospital, which is now called the Department of Global Pediatric Medicine. So I was there when it was still a very small program through its transition into a very large program. For the next 8.5 years, I had the privilege of working with nurses all over the world, collaborating in the development of hospital-based subspecialty education programs, quality improvement projects, research and advocacy, and health policy initiatives. And it was through my global nursing work that I identified my research interest of establishing quality measures for international pediatric oncology nursing practice. And I pursued my PhD and postdoctoral research at the University of Alabama at Birmingham. While at St. Jude Global, I helped to expand its nursing outreach from 12 to 47 countries, collaborating in the development of hospital-based subspecialty education programs, conducting quality assessments, multi-site quality improvement projects as mentioned, and the research and health policy initiatives. In Latin America, one of our pillar programs was the Latin American Center for Pediatric Oncology Nursing Education, which is a nurse educator training center in Santiago, Chile. This program pioneered the integration of a pediatric oncology nurse educator role and programs in Latin American hospitals, and graduates joined the Latin American Nurse Educator Network, which impacts over 2,000 nurses at any given time within the region. In addition to education programs, network members implement collaborative quality improvement projects within their institutions, such as the multi-site positive patient identification project, which is the first international patient safety goal with the Joint Commission International. So very foundational to everything we do in high-risk procedures, as well as chemotherapy and medication administration. I had the privilege of co-leading the development of the Association of Pediatric Hematology Oncology Nurses Spanish Chemotherapy and Biotherapy course in Latin America, and this course has since been expanded to Brazil and Australia. In Eurasia, we established a working group of nurse leaders from 18 hospitals in 10 Eurasian countries as part of the Eurasian Alliance in Pediatric Oncology. In 2019, in collaboration with colleagues at the National University Hospital and KK Women and Children's Hospital in Singapore, I also had the privilege of spearheading the establishment of another regional training center, which is called the St. Jude Viva Asia Pacific Nursing Institute, which trains pediatric oncology nurses through Asia Pacific, such as the Philippines and Vietnam. As you may be aware, pediatric cancer officially became a global priority in September of 2018 with the launch of the WHO Global Initiative for Childhood Cancer at a UN side event in New York City, New York. And it was my honor to have attended this historic event. Within the global initiative, 5 working groups were formed with international multidisciplinary stakeholders to develop work products and toolkits aligned with the cure-all framework, which guides the global initiative. Out of the Positive Practice Environment Working Group, the nurse specialists of the Global Initiative for Childhood Cancer was established to elevate the nursing voice within the initiative. The nurse specialists of the Global Initiative for Childhood Cancer provide technical support and advice for WHO member states regarding pediatric oncology nursing policy and practice priorities. We have published 2 papers outlining priorities and strategies for strengthening the pediatric oncology nursing workforce, including recognition of pediatric oncology as a nursing subspecialty, where nurses are dedicated to the units and not rotating, where we have an adequate number of competent staff, and expanding the roles within pediatric cancer nursing with advanced practice nursing and doctoral prepared nurses. Also a prioritization of national and facility level subspecialized nursing education programs, such as this program here today. Also to adopt strategies for retention of specialized nurses through creating positive practice environments and providing adequate personal protective equipment for nurses to safely perform their roles with hazardous drugs. And this also crosses over into the care of patients receiving radiation therapy. And last but not least, nursing priorities include strengthening nursing leadership in childhood cancer services and the voice of nursing in decision-making. Because as mentioned previously, we are all part of a very important care team for children and adolescents and their families. It is imperative that local nurse experts and leaders are given a seat at the table as key stakeholders in the initiative. And in my experience, nursing is often discussed as a priority, but nursing representation may be missing. However, I do believe that the Global Initiative for Childhood Cancer has brought nurses to the forefront in cancer control planning, and that nurses are being included at the highest levels of discussion and planning. As mentioned, through my international work, I identified my research focus and the need for a valid and reliable set of quality measures for international pediatric oncology nursing practice. To elevate the standard of practice for nurses, regardless of their setting, so that every child with cancer and their family receives high quality nursing care, regardless of the nurse's experience level within pediatric cancer. So it's to start a conversation of what is important to the care of every child with cancer. So in my dissertation study, a preliminary core set of NSIs and broader constructs, or these quality topics, were identified by an international expert panel of 122 nurses from 43 countries, and they're shown here. We did add nurse staffing to that list. It was highly prioritized by the group, but it just missed that top 10. However, we know the evidence is there to support nurse staffing's impact on patient outcomes, so we added that back in. And then in my postdoctoral study at UAB, we identified these measurable indicators reflecting these 11 quality topics. And here you can see from study phase 2, these are some of the indicators that were prioritized midway in that study, 12 indicators, and they include 5 novel or new indicators that are not standard indicators in our field. Some NSIs that we slightly modified that are existing quality measures that are looked at, and then also some existing indicators here. And I want to mention my goal is for this research that hospitals will be able to select which indicators to measure, but that we will be a part of a larger consortium of hospitals internationally to be able to elevate the standard of care, share best practices, and generate much needed data for pediatric nursing outcomes internationally. I also serve as chair of the International Society of Pediatric Oncology Nursing Network, and here is my fantastic team. We recently launched an exciting strategic plan, which is guiding our work. And I wanted to spotlight one of our special interest groups. So since we're a network, we have multiple working groups and special interest groups where you can get involved and get to know colleagues from all over the world and also showcase your work. So I encourage you to do that. But the Baseline Nursing Standards Special Interest Group started many years ago. And they had published guidelines and these basic standards for pediatric oncology nursing practice environments focused on low and middle income countries initially. These standards outline those minimum recommendations and are listed here for staffing based on patient acuity, formalized orientation, continuing education, multidisciplinary teamwork, the value of that, having adequate resources for safe care, and practice that's based on evidence. Here is the task force of the Baseline Nursing Standards, and you may recognize some of these people. Miriam Nadagiri is now a part of this as well, and this is the original task force shifted into the special interest group. We conducted a survey in August of 2016 of 101 pediatric oncology nurses from 54 countries that represented all 6 of the WHO regions. And the goal of the survey was really to identify where hospitals were at. So we included hospitals from all different resource levels. This wasn't just focused on low and middle income settings, because we hypothesized that, you know, these standards are probably something that hospitals all over the world may not necessarily be meeting. And that is actually what we found. And you can see here across the standards, the number of hospitals and the proportion of institutions that met these standards, it ranged from 12 to 66%. So thus really reinforcing the need for standards for our hospitals and pediatric oncology units in particular. So we found that the majority were not meeting the standards. There was a significant association between country income level and the ability to meet the standards, which makes sense, right? Having adequate resources for care, including personnel. Although we are not resources, that's a different conversation. But as an aside, often nurses are referred to as part of the resource budget within hospitals, but really there's a conversation to change that now as human capital and the value of investing in nurse staffing actually to improve patient outcomes instead of being a large budget item within hospitals. So just kind of keep that in your minds going forward as far as how this conversation may be evolving for getting support for additional nursing staff. But we found that there was inadequate staffing consistently within resource limited settings, gaps in specialized training and education. Again, why this course is so important that you're here for today. And also there were opportunities for nurses to join into patient care rounds with the multidisciplinary care team. And conversations with hospital administration and different supply chains to be able to provide adequate resources for safe care like PPE, and then also biosafety cabinets for chemotherapy preparation, et cetera. You can have the badges for radiation exposure. And then an absence of essential written policies and procedures that were accessible for nurses to refer back to when providing care. So again, thinking about the standardization of care to improve practice and outcomes. And then we found some significant predictors of the non-achievement of these standards. And just to focus again on, not having enough nursing staff. We know these are huge challenges, right? So I'm not, saying anything that's new here. And then investing in healthcare within the countries and prioritizing pediatric cancer. We also found that in Africa that there was more of a challenge to meet some of these standards. So maybe, due to some of these compounding issues, especially related to the number of nurses per population. Recently, a framework was developed based on the standards and the nurse specialists of the GICC priorities for empowering pediatric oncology nurses and recruiting and retaining our specialized workforce here. So you can see all of these different components. We've talked about education and training and staffing, having adequate infrastructure, career pathways for growth, which we're talking about today. And then having job satisfaction, which is linked with the positive practice environment, policies and guidelines that are evidence-based, as mentioned in the baseline standard, and then having supportive administration and leadership, shared governance, so nurses are a part of decision-making, so having a seat at the table, being a part of that conversation to help empower pediatric oncology nurses, but ultimately improve patient and family outcomes. I did want to mention in SciUp, we have a beautiful partnership with My Child Matters, Foundation S, and there are nursing awards that are provided now every 3 years. We will have a call out again in 2025 is what we're hoping. We haven't gotten the official notice yet, but keep your eyes out for this and start thinking about any quality improvement, education, or research project that you would like funding for. There is an opportunity. Currently, it's 15,000 euros for a 3-year project. And we also have other opportunities within the SciUp Nursing Network for mentored projects. So I wanted to share that with you. If you would like to get involved in SciUp, I highly encourage you to do so. If you'd like to join our social media, we have a WhatsApp channel, and then we have a Facebook page. And then I encourage you to join SIOP. It's €10 a year for nurses living in a low or middle income country, or €20 for 2 years. We have educational sessions that go on throughout the year, and then you'll also be able to join our working groups and get to know like-minded people through this opportunity. So I wanted to just briefly talk about pediatric hematology oncology nursing. So you've heard a lot about my journey and some of the bigger picture items of our global community and what are the priorities, health policy level, how can we drive the agenda? But what this really depends on is the nurse at the bedside, the nurse who is providing that care to patients and families, right? Because you have your finger on the pulse of what's truly important. So I wanted to go back because my understanding is that some of you have varied backgrounds and exposure to pediatric oncology nursing. So I'm just going to provide a brief introduction about what is a pediatric hematology oncology nurse. And so we care for kids with cancer and other blood disorders across the care continuum, from diagnosis to survivorship and end-of-life care. Actually, I would say before diagnosis with early recognition campaigns, right? Outside in the communities, so that we're bringing kids in faster to get earlier diagnoses. So it's important you can have that specialty knowledge wherever you are practicing, in the inpatient, the outpatient, or the community setting. And we provide holistic patient and family-centered care. Now, in the United States, pediatric hematology oncology nursing became a specialty in the 1970s. And in '74, the Association of Pediatric Hematology Oncology Nurses was formed, which really helped to shape our specialty within the country with standards of practice, and also partnering with the Oncology Nursing Certification group that provides specialty certification. Here it's a certification in pediatric hematology oncology nursing, which is that next step of education. They provided a chemotherapy course, which is a very comprehensive course and training for nurses in providing safe chemotherapy administration to patients. And then I also wanted to add, because we're talking about radiation therapy today, the Oncology Nursing Society and ONCC also have developed a radiation therapy certificate for adults within the US. So you can see how we're tackling pediatric hematology oncology nursing, kind of scope of practice and specialty education, but then even going further into chemotherapy, because it's, so high risk for patients and for caregivers. And then same with radiation therapy, why it's so important that we're spending this additional time so that we're up to speed on these treatment modalities. And then in many nations across the world, pediatric hematology oncology is not a recognized specialty. And although nurses and midwives represent the largest health workforce internationally, in countries with limited numbers of health workers, nurses may be assigned different tasks outside of the nursing scope of practice, and be regularly rotated between units and hospitals, as I'm sure some of you are familiar with within your setting. And although this generalist model provides staffing flexibility within health systems and hospitals, patients and families receiving care likely receive a lower quality of care, right? Due to the lack of having the expertise and experience with complex specialties such as oncology. So again, why it's so valuable for you to be here today, showing your value of gaining subspecialty knowledge and providing high quality care to kids with cancer and their families. So to ensure that nurses are providing high quality and evidence-based patient care, specialized education and certification is recommended throughout the nursing care continuum. As highlighted in the example through the US and how AFON has helped to shape some of the educational landscape and subspecialty advancement, Again, it's important that we're receiving pediatric oncology, some sort of education in nursing school, right? Even if it's one lecture, that nurses are receiving this upon entry to practice as continuing education, specialty certification, and advanced degrees. So here's our trajectory for specialization and advanced knowledge and practice within the field. And we know that specialization actually improves outcomes. So specialty nursing certification has been associated with decreased pressure injuries, patient falls, hospital-acquired infections, failure to rescue preventable deaths, and mortality. So really underscoring the quality of care here. And I have a few more minutes. I'm just going to touch on different career paths in nursing. So I want you to reflect on this, why you became a nurse. And then if you're practicing in pediatric oncology, think about why you became a pediatric oncology nurse. And then in your mind, what does a typical nursing career path look like? Well, these career paths can look very different, right? So we talked about the advanced education to help prepare us for different roles. But oftentimes there's nursing management track, there's the clinical track that we talked about with specialty certifications and advanced practice nursing roles. There's the education track going into academia, and then the research track. And research can look different as well. So here's an example from the NIH in the US, National Institutes of Health, talking about the nursing career path and research. Here you can see there's opportunities for nurses where, as a pediatric cancer nurse, oftentimes you'll be exposed to patients who are getting treatment on a clinical protocol and are enrolled on a clinical trial. So providing that care at the bedside, you're contributing to research. And it's very important, that we're recognizing our contribution as a bedside nurse to the research. And then thinking about other opportunities. So there are opportunities for clinical research nurses working on a study with a colleague and then kind of helping to coordinate those studies. And then we look at advanced practice nurses who can contribute to these studies as well, and also generating new knowledge within nursing. So there's opportunities for those who want to go on for a PhD. You can develop your own program of research, or you can work as a research scientist and as a staff scientist to work on someone else's study. So there are many different opportunities within research as well. And doctorate of nursing practice are more in that evidence translation kind of sphere here. And sometimes bedside nurses are doing that too with your evidence-based practice projects, quality improvement projects as well. So there are many different avenues and different types of research and evidence translation we can be involved in. And again, thinking about the My Child Matters Nursing Awards and designing those. So nursing beyond the hospital setting, nurses are in the public health and community settings. You can be a school nurse, a nurse educator, a home health nurse, hospice and palliative care nurse. And I say if you're a pediatric cancer nurse, you're automatically a palliative care nurse. So I hope that you wear that hat with pride because it's an important aspect to provide comfort for the patients when they need an additional layer of support, whether their goal is cure or non-curative, and then also hospice at the end of life. It's a privilege for us to be able to walk with the families and provide comfort and care for them during that time. And then to rejoice with them during survivorship, right? And to dream with them for their futures. Telemedicine is also an opportunity, and then nursing informatics, which is a really important and growing field. So I wanted to end with some tips for success, and this is just from my journey to share with you. Thinking about leadership and being a part of a team, regardless of your practice setting. So as I did early on, when I returned back home after my international experiences after high school, I developed a plan, right? So I was mapping out the different pathways of how I could get to where I envisioned going. So I encourage you to plan your work and then work your plan, right? So that you are making a concerted effort to reach your goals. Be open to detours and be patient when things or you are under construction. So we're always learning lessons, and there are skills that we can learn on any path in any role that may not be exactly where we see ourselves going, but to really try and glean as much as you can in every circumstance and on every team that you're a part of. Also, build your village, find your support network, those who can keep you accountable in achieving your goals, to rejoice with you, to cry with you on the good and the bad days. Find mentors, sponsors, and coaches, and these are different things. So a mentor is someone who can really help you with your plan and mentor you in the next step and really the details of how you want to accomplish your goals, like a project, for example. And sponsors, those are people who will speak your name to others in important rooms, so that they are making known your expertise and your values. So for example, bringing you to the table in a board meeting, like myself, I have the honor of being on the board of directors at the International Society of Pediatric Oncology, in my role as the nursing chair. And that's because someone sponsored to have a nurse on the board, and I'm the second to hold that position. So who's going to be your sponsor, and how are you going to sponsor others, younger nurses or less experienced nurses, and mentor them? And then coaches who are really kind of guiding you in those next steps as well, and to think about kind of what's the best path for you to achieve your goals. Value your team and diverse perspectives. And this is sometimes a challenge, but I think some of my best experiences have been working on teams and in projects with people who bring very diverse experiences and backgrounds to be able, and multidisciplinary perspectives, to be able to help have a better product and outcome for kids with cancer. And sometimes we don't speak the same language naturally by our training. So keeping that in mind about learning to speak the same language, this is what we're talking about, and this is how we'll get there, and kind of merging those different training backgrounds together. Fly like a goose. I love that the dean at my college has used this example, and it's something I've thought of myself as well, about leadership styles. So geese, as we know, they fly in a V formation, and they each take turns leading, and then they fall back. So I would encourage you to be okay with leading and then letting others lead, depending on the time and the position, especially if you're in an emergency case situation in the hospital, right? You know, you have your role and you're going to call for help, and then you're going to intervene, and then somebody's going to run a code if need be, etc. So that's a clinical example. And then the golden rule: treat others as you would like to be treated. As we are working our plan, don't forget those who are walking alongside you, your teammates. We might have a rough day, but this is something that I think we can all come away with, of saying how much we value our team members, and that they become like family after a while. So just, always being kind. And then stay curious. I'll leave you with that. So keep that spirit of inquiry. Never stop asking why. It's okay to ask why. It's important you do so that you can be well informed to guide your patients and families in the care decisions that they are going to be making, because you are their best advocate. And then also to challenge the status quo. If there's a better way for an evidence-based practice to be implemented, for example, that's maybe there's a process that needs improving, you can champion that. So find the authority figures in your hospital and talk to them about that and find solutions. Be a solution bringer. So whatever you do it with all of your heart and soul. And thank you so much for your time.